Hi, everyone. We're going to get started. My name is Sarah Stream, and we're so excited to bring you the student rally tonight. So the ADAA was wanting to do something for students and new graduates and dental assistants that are new to the field to help you understand the profession a bit more and get out and get your toes wet. So we decided to put together this student rally. I put out a Facebook poll a while ago to pick out some topics. So we've got some good topics for you this evening. We're hoping to keep this to about an hour, so we'll try to get some questions answered if we can. I just want to let everybody know that our speakers tonight, everything they're talking about are their views and their views alone. They're not in any way associated with the ADAA. And welcome and congratulations. If you are a new graduate, great job on all of your hard work. If you are new to becoming a dental assistant, welcome. We love to have you. So tonight we're celebrating you and your hard work, and we're going to kind of introduce our speakers a little bit, and then we'll get started and I'll have them introduce themselves when they speak as well. So tonight our topics are Robynn Rixse, our current ADAA president, will be speaking about membership and networking. We have Natalie Kaweckyj, who is our immediate past president, speaking on interview tips. I will be speaking on working in specialty offices. Lisa Childers, our 9th district trustee, will be speaking on how to get a job without experience. And then we have a very special guest, Cathy Price from dentalworkers.com, who will be talking a little bit about the job market and some guidelines on compensation questions. So if you have questions, feel free to type them in the question box as we're going through this, and then at the end of everyone's presentations, we'll go through and try to answer as many questions as we can. This webinar is being recorded, and we will post it to our YouTube channel for anybody that has missed it. So just keep that in mind as you're asking questions that you may be out on YouTube. All right, so with that, thanks for joining us. It looks like we have about 70 people in with us right now, which is awesome. Welcome, everybody. We're going to get started with President Robynn Rixse speaking on networking. Robynn.
Wonderful. Thank you so much. It's really an honor to be here. Thank you guys so much for joining us. You are joining an awesome profession. I know we may be facing challenges right now, and you have stuck through it and graduated, and I just really want to say how proud we are of you. And that just brings me to a really important point. Student membership is one of the absolute best times to get working with ADAA, to become affiliated with us, to become a part of it, to become engaged. And there's just so many opportunities as a student member. And some of the greatest points that I want to make you aware of is the fact that you start at a really low rate. It is really important for us that you have the opportunity. We know as students that finances can be a challenge when you're first starting out, so we really make it easy for you. The first year of expenses is just $35. If you want to add liability insurance, that's just an additional $10. And so we really start out at a low cost for you so that you can take advantage of all the benefits. And that being said, at that low rate, you still get all of the great membership benefits, and that includes free continuing education. We have over 100 continuing education courses, and I would like to just let you know that I've been in the profession for 30 years, and my professional job is a practice manager for a private practice dental office. And one of the first questions that I ask individuals that are coming in to interview with my office is, what is the most recent CE course that you've taken. And why is that important? It lets me know that you are one of those individuals that wants to continue to learn and gain as much knowledge as possible so that you can be as informed about what you're doing in the dental office as possible. So keep that in mind when you're out interviewing for jobs, just in case you come across someone like me who that's an important question for them. As a student member, you have all of these courses that you can take and be ready to answer that question. Another opportunity you have is for the Dental Assistant Journal. That's the ADAA publication. And these stories and articles are written by people in the profession, and they're meant to motivate and inspire you and to inform you about what's going on in the profession, what's available in the profession, and what you could potentially move into. And those are just some of the really important aspects of membership. And like I mentioned, we start out at a low cost, and we keep in mind that professionally, it's going to take a little bit of time for you to build up to that level of being a full-time professional dental assistant. And so over the next 3 years of your membership, we prorate those dues for you. And you can, if you can see them here on the screen, you see that you don't have full paid dues until the 4th year of your membership, and that's really important for us to be able to offer that to you. So why is networking important? So networking is important because of a number of things. One, it really opens up the door for you for employment opportunities. A large majority of the jobs that I've had over my 30 years were not jobs that I applied for, but instead I knew an individual who reached out and said, Robyn, you know, we're looking to fill this position or that position. So networking really gives you the opportunity to broaden your horizons, to hear about jobs that might not necessarily show up on a job site. So that's important too. It also gives you the opportunity for personal and professional growth. When you are interested in possibly going on and maybe getting your certified dental assistant or your fellowship or mastership within ADAA, having other individuals that have been there and done those things and being able to reach out to them to ask them questions or to ask them to be your members, your mentors, that's just a really good way to help you succeed at whatever it is that you choose to do personally and professionally. So here's a couple tips that I want to offer for you. So when you're out there, say whether it's your externship, your internship, or whether you're at that first job interview, don't burn bridges. Always be professional. Show up when you say you're going to show up. If you have an interview scheduled, make sure that you arrive on time. It's even a good idea to arrive early and just be prepared. I've recently been doing some hiring, and last week alone, I had 2 individuals who we scheduled interviews on the same day not show up. And that really, as those resumes may come across my desk later on, it makes me stop and think, well, if they didn't come before, why would I want to put that effort out to try and offer them a position again? So always be professional, show up for your interviews. And then as far as some other things to think about is social media posts. Just be careful. Social media is a great way to network, but just be careful what you're putting out there because I've heard of a lot of employers that take a look at those things. So just be aware of it and make sure that always, again, being professional and putting your best face forward whenever you're doing any kind of social media posts. A great way to get involved if you want to do some social media networking is to join the ADAA Facebook page. That gives you the opportunity to hear what students are doing, what dental assistant professionals are doing, and kind of see some of the challenges, some of the opportunities. Just a great way to continue to network, especially during these times right now where unfortunately we can't do as much of our meeting in person. It's a good way to still stay connected with one another. So networking connects you with other dental professionals and just keeps you in the know. Another networking opportunity for those of you who have the chance, make sure you're staying in touch with your dental educator, your instructor, and reach out to them. A lot of times when I'm looking for individuals to hire, I'll reach out to the local dental educators and just say, hey, do you have anyone who's looking for a position? So that's another way to make sure that you're doing as much networking as you possibly can. Because as you see here on the screen, it says sometimes who you know makes all the difference. And you never know who you've come in contact with, who may be that good networking person down the pike that allows you the opportunity to find the job that you're looking for and get you started on your profession. So again, you've entered a great profession. We look forward to helping you out. One of the best ways to network, as I mentioned when we first started, is to join the American Dental Assistants Association, become active at your state and local level, and then participate and engage at the national level. And there are mentors out there who would love to help you grow personally and professionally and point you in the right direction for leadership opportunities as you continue to grow in your profession. So if any questions that you have, please feel free to type them into the chat box, and I'll be happy to provide answers to those questions. And I look forward to hopefully someday soon being able to meet up with as many of you as possible when we start attending national meetings again. So thank you for being here. Congratulations. I'm really proud of you and look forward to seeing what the dental assisting profession can do for you. Thanks, Sarah.
Thank you so much, Robyn. That's great advice for everybody. And I can't echo enough how important it is to meet people in dentistry. It definitely is a game changer. So our next speaker is immediate past president Natalie Kaweckyj, who will be talking to you about some interview tips if you have interviews coming up. Natalie, would you like to introduce yourself?
Sure. Good evening, everyone, and thanks for joining us. As Robyn and Sarah have said, my name is Natalie Kaweckyj, and I am from Minneapolis, Minnesota, where I've been a dental assistant now for a little over 28 years. I've had the opportunity to work academically as a program director in a CODA accredited institution, as well as administratively, and currently I work clinically. I have had the opportunity to become an author, an international speaker, just involved in a lot of different things. So the world is your oyster on things that you'd like to do in the future. But we're going to talk a little bit about some interviewing tips. For many of you, it might be your first professional interview out of school. There's some things that you'll want to do before you actually have your interview. And as Robyn and Sarah had mentioned about social media, a lot of employers do check social media sites prior to meeting with a candidate. So you want to make sure that if your settings are not private, that whoever the person is that may be checking up on you is seeing a professional you. Another thing to do is to Google your name and see what comes up. Sometimes there's erroneous information out there on the internet about individuals or people that have the same name. So just be aware in case a question comes up about that. Also, if you are a Twitter fan who likes to tweet, make sure your tweets are also professional. Think of some thought questions prior to going to your interview. Oftentimes people will ask, tell me a little bit about yourself. What you'll want to do is actually focus on your skills as a dental assistant, not your family, not your hobbies unless you're specifically asked. Also do some background information on the practice that you are interviewing for. And think of some questions to ask the interviewer. Certainly, other than salary and hours and things, you can ask, what is the longevity of your current staff? Usually if it's not very long, there may be a reason or a red flag that may come up. Background checks and drug testing. A lot of employers now are doing background checks, and not so many doing drug testing unless you work for like the Veterans Administrator or Veterans Affairs hospitals, or any type of federally a federal institution. So be prepared for background checks, and anything that may come up in a background check, you may want to disclose ahead of time. References. Usually the standard 3 is what is normal for somebody who is newly entering the field. Make sure that none of your references are family members. That's kind of frowned upon by hiring managers. It is certainly acceptable to have one of your instructors be one of your references. And better yet, if you did complete an externship at another dental office, perhaps the dentist or the office manager would be willing to also be a reference for you. References are usually on a separate sheet, separate from your resume, but make sure to have them when you go into for your interview. Now, during the interview, a lot of hiring managers use what they call the STAR technique. And what the STAR technique is, usually focusing on some type of scenario, and it'll ask you certain questions, and what they are looking for is how you would react to certain situations. They can kind of judge character by the responses the candidate gives. And what it means is S stands for situation. So you'll want to have some type of context to your story. They may ask, you know, can you give me an example of a time that you had a disagreement with a superior, your boss, or a higher up, or a coworker? Then they'll probably ask, well, what was your role in the situation? So these are some things that you'll want to think about ahead of time. A stands for action. They'll ask, well, what did you do in this case? How did you resolve it? And R stands for result. What did your actions lead to? And what you want to do is you want to focus on the positive, even if it's negative. You want to spin it so that it is positive. Also during the interview, certainly some offices may ask you to do a working interview, and that is where you either come in on a different day and work part of the day, sometimes the full day, to see how you adapt to the current team that's working and the environment. Some offices are a piece of cake, a breeze to get in and, you know, pick up everything, and others are a little more chaotic. So it's a good judge of how you will succeed in the environment. So it's often good to include a pair of scrubs in your car when you go to the interview, just in case they do ask if you would be willing or able to stay for a working interview. But it's certainly acceptable to schedule on another day. After the interview, it's certainly important to follow up by sending a thank you note. Handwritten thank you notes really go a long way. What it does, it puts a little reminder into the hiring manager's mind that this candidate took time out of their day to actually handwrite a thank you note for the interview and the time spent with the candidate. So usually thank you notes should be sent, you know, almost immediately. And it is acceptable to ask, you know, when you can expect to hear one way or another. And some individuals will tell you, you know, we'll let you know in a week or so. And certainly if it's been a week, it is acceptable for you to follow up with that individual. The number of interviews can vary from person to person. A little bit about my personal story, my first job out of dental assisting school, I went on 24 different interviews because I was looking for a specific practice. I wanted one that was downtown near the university because I'd planned to continue my education in the evenings. I looked for one that wasn't open in the evenings, preferably didn't have Friday hours, although this practice was open for 4 hours on Fridays, and certainly no weekend hours. And so the very last place I interviewed, I had called because I hadn't heard anything after sending my resume in. And it was a good thing I called because they had never received my resume. And I had the opportunity to work with that office for 12 years. It was a general private practice. And as a result of working in that practice, I was really able to expand my interests and my skill sets at that practice. I unfortunately, or fortunately, had an opportunity to teach, and that was the reason why I left private practice. So don't be upset if you don't land your first job. And certainly if you do accept a position that may not feel right, best thing to do is to accept it and continue looking. So I wish you all the best of luck in your interviewing and job search. And we will move on to Sarah. Thank you.
Awesome. Thank you so much, Natalie. So my name is Sarah Stream. I am currently the 8th District Trustee for the ADAA. I have been a dental assistant for about 13 years now and have held a lot of positions in an office. I've also recently been a CODA educator. So one of my favorite classes to teach when I was an educator was specialties, just because there's such a huge variety of stuff that goes on in dentistry. And when you are working in a general practice, you kind of get your fingers wet in a little bit of all of it. But if you make the jump to work in a specialties office, it can be a really big adjustment. So I just kind of wanted to touch on some of the specialties that are out there and differences in working in them. So as of right now, the ADA recognizes these different specialties. So we have orthodontics, pediatrics, perio, oral and maxillofacial surgery, prosthodontics, endodontics, public health dentistry, oral and maxillofacial pathology, oral and maxillofacial radiography, and then a very new dental specialty that is being recognized is dental anesthesiology, which I don't know much about because it's so new. So we're going to focus on the others tonight. When you start work in a specialties office, there's going to be a learning curve. The doctor will be doing totally different procedures. They'll be using different instruments, different setups. You'll have different equipment than you would find in a general practice. If you are wanting to go into orthodontics, which I know a lot of, especially new assistants, love orthodontics because you kind of get to work on your own a little bit. The biggest difference in orthodontics is they use a lot of pliers and they use a different numbering system for the teeth. So if you've been used to the universal numbering system 1 to 32, which is usually what's taught in CODA schools, orthodontics is a little bit different. So that will be a learning curve. If you want to get into pediatrics, pediatrics is primarily the same as a general practice, just everything is smaller. You know, you have the smaller forceps and you have smaller matrix bands and all of that. Pediatrics will also get into a lot more of the sedation techniques as well with children. So whether that is oral sedation or using nitrous or an IV sedation in an oral surgeon's suite in a hospital. And a lot of times pediatric offices also treat special needs patients that maybe general practitioners aren't able to treat. If we're working in perio is fun. So periodontics is working in the gum and connective tissue surrounding the teeth. So there's a lot of surgery and implants in perio. I have a good friend who works in a perio office and she absolutely loves it, but she loves that oral surgery, you know, getting in there, seeing the bone, placing implants, that kind of stuff. So if you are inclined to like oral surgery and some of the more graphic procedures, then perio might be a great option. Obviously, oral and maxillofacial surgery also, they do those big sedation cases. There's a lot of facial reconstruction done in an oral surgeon's office. Obviously, extractions, if a general practitioner is not able to do those, then they get referred in. Wisdom teeth is a big one. And once again, that's a little more on the graphic side of things. So I know a lot of people who just can't stomach that, and that's absolutely fine. Just don't go there. Next would be prosthodontics. So this would be fabrication of dentures and partials and appliances. In prosthodontics, you're taking a lot of impressions. So that is one thing going into a prosthodontics office that you need to be mindful of. I know impressions can be frustrating for a newer dental assistant, but I promise you that if you practice on yourself, practice on your coworkers, just get the practice in, that you'll do fine. Endodontics. Endodontics are root canals. So obviously we have a lot of root canal setups, the files, the reamers, you have the electric motors that have files on them, all of this fun, cool technology to help get rid of that inflamed pulp and get the tooth feeling better. There are a lot of other procedures in an endo office though that aren't a root canal. So things like an apicoectomy. So taking the infected root tip off of a tooth and retrofilling it. I know they have procedures where they can actually do kind of a crown extension where they actually pull the tooth out of the socket a little bit to give you a couple extra millimeters. So there are fun things that happen in an endo office that aren't root canal related. I think one of the biggest pieces of equipment working in an endo office would be the microscope that the doctor uses. So there's actually a large microscope that they use that sits over the patient's face so doctor can see what's going on. And it's, if you haven't been into an endo office to see that, it's a really neat piece of equipment. Next is public health dentistry. This is kind of a newer facet of dental assisting, and it will depend on the state you're in whether or not you can get into public health. But this would be going out into those community health centers and working with hygiene and dentists to provide those public health services. Oral and maxillofacial pathology and radiography. So pathology is the study of those pathogenic diseases, and then radiography is taking x-rays and being able to read them. So those two specialties usually happen at a university level. They have pathologists and radiologists that test those things, the biopsies that get sent in, and read those radiographs and then send those results back to the doctors. I can't speak too much on dental anesthesiology. I know there is some big things happening in Minnesota right now with that in dental assisting, but it's all on the forefront right now. So Overall, working in specialties can be very fun, especially if you have a preference of what you want to do. For me, I always enjoyed working in a general practice because I got to do a little bit of everything. We would do a root canal every once in a while, and we had someone in braces, and we got to do a bone graft, and you know, there's just a little bit of everything in a general practice. But specialties, even though they're different procedures, instruments, all of that can be super fun, especially if you are hyper focused and have a favorite specialty in mind. So don't be afraid to put your name out there and apply for those jobs in specialty offices, especially right out of school. You know, if you want it, go for it. Next, we're going to have Lisa Childers speak to us about how to get a job without any experience. Lisa?
Hi, and congratulations to all the graduates and the new dental assistants into the profession. During this time with COVID and everything going on, this is a great career to get into. I know that you're, as a recent graduate or as a new assistant in the field, you struggle to try and get a job without any experience. My first suggestion that I tell my students is research the offices that you are applying at. You can Google these offices, you can look at their Facebook pages, get all the information that you can about the office and what they do. If you know what the office is about, what they advertise, the audience that they're appealing to, you can highlight the skills that you accomplished in school that fit that office. As everybody said before, on social media, you want to make sure that you watch what you post, and you don't want to post anything controversial or anything. You want to remain positive at all times. In your interview, when you're talking to the office manager or the dentist or whoever is doing the hiring, you want to highlight the skills that you accomplished in schools. If it is an endo office, you want to highlight those endo skills and use the terms that you learned in school that apply to that field. You don't want to go in there and say, you know, that thingamajiggy that you pull the tooth with. You want to refer to your clinical experience. Very often in your clinical experience, your dentist and the dental assistants that are precepting you will be excellent references. So you're always going to try your best at your clinical experiences and get the most of them, because that's what they're for. They're for learning. Another way that you can gain some experience is volunteer at free clinics. I live in a very rural town in Arkansas, and we have a free clinic that is 2 nights a month. And I suggest my students volunteer at that clinic with the different dentists just to learn the skills from the different dentists. And my last suggestion to get a job without experience is suggest a working interview. I believe Natalie said earlier to take a scrub outfit with you and be prepared. If they don't offer a working interview, ask to do one. I have offices that will only hire through a working interview, and I have others that will hire you just based on how you pulled off the interview before they even learn what your skills are. Always remain positive. Another good source that I did not put on here is refer to your dental assisting instructors. They always know who's hiring, and they will strive to put you in the office that meets your skill set or what you would like to do. And again, mine's very short and sweet, but if you have any questions, please type them in and I will respond to them at that time. Congratulations to everybody.
Thank you so much, Lisa. I think that it's important that everybody remembers that the dental community as a whole is fairly small. So once you start getting your name out there, people will remember it. I have run into so many people that I introduce myself and they're like, oh my God, I heard of you from so-and-so. And they just start going off. So that's always important when you are getting out with networking and trying to put your name out for interviews and put your resume out. So our last speaker tonight is Cathy Price from dentalworkers.com, and she's going to share with us a little bit about the job market and some compensation.
Hello, thank you so much for having me here. I really appreciate the invite tonight, and I want to congratulate all of you who have just graduated and are in the new career, not job, but career, and we'll get into that, for dental assisting. A little bit about myself. I've been in dentistry for about 38 years. Yes, I'm one of those old individuals that have a little bit of experience in this. I'm a retired dental hygienist, 20 years now, retired wet-fingered hygienist. So started and founded dentalworkers.com 20 years ago, and it is actually the premier job board for the American Dental Assistants Association, I'm very proud to say. So thank you very much. And a little bit about compensation. Now, all of this is great news for you. Coming into the field of dental assisting, according to the United States Department of Labor and U.S. Bureau of Labor Statistics, gave me the tools to be able to convey some really great news for dental assistants coming into the field. So some quick facts about dental assistants is that the median pay is actually about a point higher than the average of all other pooled careers in the United States, which is really, really great news for all of you. Let's talk about the median pay. So median pay means that half of the people in dental assisting actually made more than $19.27 an hour, and half of the population in dental assistings made less. So how do you fall in? And we're going to get into that, how you can do a self-assessment of where you are in your career in order to have a bright future. So the DA job market, actually the job outlook for all of you coming into the field is amazing. It is actually 11% faster growing than any average of any other career out there. So you are definitely in a good place. You're in a good place if you continue your practice and your education and move along in your career where you can actually execute your goals. And this is an amazing outlook, and I'm so excited to be here today to be able to convey that for you. The job outlook here from the Bureau of Labor Statistics actually took from 2018 to 2028, 10 years, and started it as a base for you to be able to elevate in numbers. So there is going to be a need for you of about 38,700 more dental assistants are in need of a job, needing to be utilized within the dental field between now and 2028. So this is bright for you, definitely coming into the field. And the last slide, and you can definitely, ask me any questions offline if you need more information, but the members can access the ADAA job board to be able to bring your knowledge, your gifts to employers throughout the United States on dentalworkers.com. Now, what I heard tonight from the other speakers is absolutely true. I talk to employers all across the US, and their biggest complaint is lack of accountability, where people don't show up for their interviews. And if you can do that, you have a very good step ahead of you. There are certain ADAA membership benefits, and a great way for you to be able to utilize those benefits is for you to become a member of ADAA. And you can utilize CE, which is another way for you to elevate yourself in order for you to get above that median and be able to make a really great, practice for yourself, for your goals, for you to be able to become a dental assistant career person, a person who can actually, be valuable to an employer. And the more value you can be to an employer right now, the higher you are in that medium grade of being able to make more than the median pay. It is commensurate upon experience and your education. More education, more money. And that is true, absolutely, and accountability. Those three things will be able to really excel you and your career. Having an up-to-date resume, being able to reflect where you are now, setting your goals, updating your resume, and execute your action. If you do that, you're above and beyond the average that is out there right now working as a dental assistant. And on that note, I thank you again for including me tonight in your rally. And congratulations to you guys.
Thank you so much, Cathy. We really
You're
appreciate
welcome.
you taking the time tonight.
You're very welcome. Thank you for having me.
Absolutely. All right, so we've gone through all of our speakers. So I've seen a few questions come into the question box, which is great. We're going to get to those in just a couple minutes here. If anybody else has questions that they want to ask, keep putting them in the question box and we'll go through them. We have an exciting thing for you guys tonight. I'm super stoked about this. We are going to be drawing for 4-year memberships for 4 of you attendees tonight. So if you want to become a member, what you can do is submit your name, address, your personal email, not your school email, your phone number, your graduation date, or when you started in as a dental assistant, to Jennifer Porter, who is our membership person here at the ADAA. So her email is there at the bottom of the screen, jporter@adaausa.org. Send her an email with the subject line reading student membership drawing. You have to be within 6 months of graduation or starting in dentistry. So these are for brand new graduating dental assistants. And we will be drawing names from all the submissions that we get for 4 people to win a year's membership. You guys have 24 hours to get your submissions done. So if you want to do that, I know all of you guys are multitaskers, right? And you're probably watching on your computer and you have your phone in your hand. Send an email to Jennifer right now to get in this drawing. We're going to close the drawing off tomorrow night at 7 p.m. Central Time, okay? So you have 24 hours to get your submissions in. I hope that we get a lot of people that submit, because why would you not want to be a part of this awesome group? When Robyn talked about networking, joining the ADAA is the best form of networking there is. It has done so much to help me personally advance my career, and I have great friends in the dental industry from all over this country now. So get in the drawing. If you want more information on how to become a member, you can absolutely head over to our website. That's ADAAUSA.org and learn how to become a member there. Does anybody else have anything they want to add to this membership drawing? No? Okay. Let's go through some questions then. It looks like Kendall asked, when is a good time to apply to jobs? I graduate in December, so is now too soon. Also, what's a good website to apply? Indeed. Does anybody want to take that question?
So this is Robin. Both Natalie and I did respond, and you know, it's never too early just to reach out to the offices in your area and, you know, send in a resume. A lot of times I will collect resumes throughout the year, and when I have a position that needs to be filled, I have a pool of assistants to pull from. So that's always a great idea. I hope that you listen closely to Cathy's conversation about the job posting abilities for members. It's a great way to post your resume and get the information out there. So that's definitely an option as well.
Awesome. Thank you so much, Robin.
Can I jump in here? This is Cathy, and in support of that, thank you. I wanted to also explain a little bit of the difference why employers come back over and over again to use dentalworkers.com. Employers are coming from all types of employment areas, military, public health, we're talking about private, DSOs. There are many, many, many opportunities on dentalworkers.com because it is a dental related niche job board only for dentistry. Indeed, Monster, you know, they have all types of opportunities for all types of careers. I have very high level employers that come back over the 20 years when they're hiring somebody, and usually when they hire, they're really looking at a qualified individual that can really add value to their practice, and their salaries usually are commensurate about that. So I just wanted to, you know, put that in there a little bit, why a dental niche job board is over and above maybe a job board that uses all, you know, has all types of careers that use it.
Awesome. Thank you, Cathy.
Yep.
Ryan says, I'm currently not on social media. As a future DA, would it be advisable to use social media as a resource? I think that social media can be a resource, but don't think that it's your only resource. There are a lot of good dental assisting groups, Facebook groups. The ADAA has an awesome Facebook group. There are tons of them out there, but they can be good resources, but don't always believe what you read. There's also a lot of people that like to vent about what's going on in their office. So keep that in mind as well. Abraham says, where can we find this recording when the presentation is over? We will have this recording up on YouTube, I think probably within 24 hours. You can just search our American Dental Assistants Association channel on YouTube and find us. There are a couple of other videos on there on some how-to stuff in dentistry and what's been going on with everything lately in the world. So,
Sarah, this is Jennifer. I just wanted to add to that. You can find our YouTube channel on the ADAA website, which is on the slides on there. It's ADAAUSA.org. Yeah, so if you go on to the website and under, I believe it's under publications, there's a link for our YouTube channel.
Awesome. Thank you, Jennifer. Karen says, is there a big difference in pay between an RDA and an orthodontic assistant? Karen, I think that will depend on the area that you're in. Everything is so different state to state, and in some states, they don't even require you to be registered or licensed to be a dental assistant. So there's a big variation in that. Does anyone else want to speak on that?
This is Cathy again from dentalworkers.com. Let me add a little bit to that. It does depend on geographic area. However, it also depends on level of experience and your skill level, if you have experience in that, or if you have, or they have to train you on the job for it. And also if you have education, like your last CEs, and find, what kind of skills that you have based on education will definitely affect how much you make in any dental office, either as an RDA or CDA or any kind of expanded function or any kind of a specialty dental assistant. What I hear over and over again is that there seems to be a shortage of good orthodontic assistants. So if you wanted to maybe find skill set in that might open a lot of doors for you.
Thank you.
Yep.
Next, Leslie is asking, can current students who graduate in 2021 still apply for the membership drawing? Absolutely. I should have been a little more clear on that. If you are a current student in a program or have graduated or started in dental assisting within the past 6 months, you can absolutely apply for the membership drawing. So if you are a student, get it done. Abraham again asks, what are some good ways to add positive volunteer experience related to the dental field on our resume?
If I can, this is Robyn. I'd love to respond to that. One of the best jobs I've had so far in my 30 years of being a dental assistant was as the dental clinic administrator for a homeless mission. And there was a health services attached to it and a dental clinic there, and I was in charge of the dental clinic, and we would have students come in and do their internships, externships with us. And that was a really great way to get to know, I believe Cathy mentioned earlier, or I'm sorry, Lisa mentioned earlier, a great way to get to know dentists in the area. And those dentists, when they're looking for assistance, would reach out to me and say, Robyn, do you remember last Friday when I worked with that student from the local school? What was their name? I really enjoyed working with them and we're looking for someone. And I would have dental assisting students that would have jobs that came as part of their, just from volunteering. So check your local homeless shelters, check your local clinics, and just see the volunteer opportunities that are there, because as Lisa said, it is definitely a good way to get your foot into the door into the different offices where these dentists who are volunteering are coming from.
Awesome. Thanks so much, Robyn. It looks like our next question is from Anusha, and I'm sorry if I pronounced that incorrectly. They say, I would like to know what certifications other than dental assisting experience and registration we need for becoming a dental assisting educator. First off, that is awesome ambition that you want to be an educator. For me, having a background as an educator, in order to work in a CODA program, you need to have a bachelor's degree and I believe 2 years of experience as a dental assistant. Is that correct, Natalie?
No,
That
it's
is
not.
correct.
This is Lisa. According to CODA, you can be a dental assistant instructor with current experience.
Oh,
They
they've
took
taken
out
off
the
that
time
stipulation.
limit. They took
Okay,
out the time limit.
gotcha. Okay, so you just need experience as a dental assistant and you need a bachelor's degree. They don't stipulate what your bachelor's degree has to be in. It doesn't matter. It just has to be a bachelor's degree. And then whatever program is hiring would have their own stipulations as well on what experience they want. Next question is from Anna. Do surgical assistants make more? I think we kind of talked about that with orthodontic assistants. And then do I have to be a dental assistant to complete the dance course? Does anybody know anything about the dance certification?
I do not, but I wonder if the requirements would be listed on the website for the oral surgeons that offer the exam.
Yeah, I don't know anything about the dance exam. I'm sorry, Anna. It's definitely worth some research because, like we said before, the more education that you have, the better off you'll be. And the more, I think I heard Cathy talking about it before, having an alphabet soup behind your name. So you can get certifications and more of them and more of them, and pretty soon you have all of these letters behind your name. And that looks very impressive on a resume. So don't ever stop learning and getting all of the certifications that you can. I think that is all of the questions that we have. So I want to thank everybody once again for joining us. If you haven't already, send that email to Jennifer about the student membership drawing. Make sure to include either your graduation date or the school you're attending right now if you're a current student, or your dental assisting start date. So when you became a dental assistant. And we will be drawing 4 of you to receive that free 1-year membership. Hopefully we're going to be making a Facebook Live post here in the next couple days with the winners. So keep an eye on the ADAA Facebook page for that. And once again, thanks for joining us. Does anybody else have anything they'd like to add?
This is Robin. I just want to say, all of you out there that are listening, you are our future. We need you to step up and assume a role of leadership and to be passionate and dedicated about your profession. And we want to help you get to that level. So please join the ADAA. Let us help you be all that you can be as a dental assistant, as a professional, you know, in your personal life. We need you, the profession needs you, and we just really want to help you and love it as much as I hope you can hear all of us that have told you that we've been in it for 28 years and 30 years and 38 years, whatever it is. We stayed in this profession because we love it. All of the challenges that may come our way, we overcome them and it makes us stronger for them, and we just love what we're involved with. And so please let us help you feel that same way about your profession, and 30 years from now, let it be you that's sitting here teaching the next future generation of dental assistants.
Thank you, Robin. If you're not already a member of the ADAA Facebook group, jump over there and join us. There's a lot of great conversation that happens there. There is a lot of great advice that happens. It's a great place to ask questions if you're unsure of something. And yeah, we would love to see you there. And thank you so much for joining us tonight. So we're going to hop off now, and don't forget to get your name in for the drawing. And congratulations.
Way to go, everybody.
Thanks, everyone.
Thank you. Y'all have a
Thank
great
you.
night.
Have a great night. Bye-bye.